going, ticking away. We are live now. We're just waiting for some people to pop in. And a couple of seconds in. Wonderful. Well, it's 8 o'clock today on Wednesday, and today we have the privilege of having Dr. Sheena with us. Now, Dr. Sheena is a traditional Chinese medicine doctor. She's had 15 years of practicing Chinese medicine. She has a clinic in Moonee Ponds, and she specializes in women's health, fertility, women's health from inside out, and also specializing in cosmetic acupuncture. So I've been to Dr. Sheena, so that I can highly recommend her. I've been to Dr. Sheena when I was about to turn 50. You know, you want to perk up your skin and look nice. So I had an acupuncture, series of acupuncture treatments done with her. But the most important thing I got out of you, Sheena, was the aftercare, the skills you gave me and the tools you gave me to do the skincare at home, which I think is more important than just coming to you once a week for treatment. What you do at home makes a big difference. So can you share with us some tips we can do during COVID, because things have changed. When we're in COVID, we're not wearing as much makeup. Also, we've got these masks on. What can we do, and how has our skincare changed because of this situation?
Yeah, thanks, Shavita. Thank you so much for having me on too. And what a great time to share some, natural skin tips to help, keep your skin looking really good and keep yourself really healthy, because it's such an important time for that. As you know, as you've explained, I am a Chinese medicine doctor, so I work from the inside out and not just from the outside in, which a lot of other, beauty approaches take. So it's about looking at your skin holistically and understanding what's contributing to skin not looking its greatest. And we can also talk about a little bit about what we can do to overcome some of the issues from wearing masks all day long, if that's you. And it can be really challenging for your muscles and your jaw and all the muscles in your face. So I'll show you a little bit of that stuff later.
Excellent.
But yeah, I guess today I'd really like to share with you some things that are really accessible to anyone who's at home. You don't need any special tools. In fact, I'm a really big fan of making sure that, when people look after themselves, they can do it with what they have around them. So using food as medicine. And another thing that I love showing people is how to do gua sha, which is a part of traditional Chinese medicine, actually.
I'm looking forward to that, because I haven't done that with you yet, so that will be interesting.
Yeah, and in your sessions with me, Shavita, we did some jade stone. You might remember us using the jade stone, which is this beautiful thing, which is really getting a lot of traction around the place as a really good tool for helping with premature aging and helping to nourish your skin. But today I want to give you guys tips on how to use just the regular spoon that you've got at home in the drawer, because I don't know how many of you guys have got one of these, but we've all got one of these. So
So would you say the spoon, I've got my spoon with me too, would you say the spoon is just as effective as using the jade stone, or?
Good question. Yeah, so the jade stone, look, it's got a lot of traditional properties. I love using it because that's just what I love to use in the practice, because it's got this beautiful shape and lots of little nooks and crannies that you can get into certain spots. So it is a bit more of a specialized tool. And also jade, for the people who love, stones and the properties of energies of stones, then jade is really closely linked with femininity, strength, and it's a really nice tool to use. But if you don't have your jade, then this is okay to use too. It doesn't have the perfect shape, but you can do a lot with it anyway. So
how does that help with your skin, and what do you show us how you can use the spoon and why it's so helpful for us?
Absolutely. So the skin, the muscles on the face and the skin of the face is exactly the same as the muscles and the skin on the rest of your body. And so you know what it's like when you go and get a massage or you tone up at the gym. You know, you're the yoga queen and the queen of toning. And so, I mean, just look at you. You look absolutely gorgeous. And that's because you work on toning your muscles and you look after yourself. And it's the same for the skin. So when you tone your muscles and when you strengthen them and give them good nourishment, then you will get, the muscles in your face will look really good. And it's the same thing with tight muscles as well. So when you massage the tight muscles, there's layers of tissue underneath the skin called fascia, which is a really dense, tight connective tissue, and that can get really, really tight. So if you've ever felt your forehead and you feel, particularly around the jaw and these muscles here, how kind of tight it can feel under the skin, that's fascia. That's a really tight connective tissue. So this actually helps to smooth that out, and that in effect actually softens the wrinkles, because the wrinkles it's not just about wrinkles, but it's also about lymphatic drainage and circulation. But the skin sits on a layer of muscle, and maybe a bit of fat as well. So if you affect the muscle and relax it under the skin, then it's actually going to show in the surface. So it's a really simple concept, but one that maybe we don't think of as much when, we're thinking about skincare. So we're kind of working from the inside out. And so we're massaging and moving and draining the muscles and the skin. Yeah, when we're doing this.
So how would we do it? Show us how we can do this at home.
Demo time.
Yes.
Yeah. So whatever you have on hand in the cupboard, I've just grabbed a little bit of vitamin E oil here. You might have olive oil. Cold pressed olive oil is fantastic. You might have your favorite moisturizer. Most of us do. Just get a little bit and pop it on an area that you need work. I particularly get tight around the jaw, and I overthink stuff, and so my forehead can get really tight. So I'm going to do a demo here because this also is really good. I've just had a full day of telehealth in the practice, so I can use this. This is great. But basically rub on your oil, and then actually I might do it this way, and then just rubbing. You're actually zigzagging over. You'll see some fine lines forming here. You just zigzag over the fine lines, and you're literally rubbing them out. It's kind of a simple technique. You rub them out just with the edge of the spoon. You don't want to go straight on because that might be a little painful. You want to just angle it slightly and then rub out. And working on areas, you'll find areas that are tight, and you'll find knots, especially in your brow. And if you come across little lumpy knots, you can spend a little bit of extra time just working on those. And this is something that personally
How hard would you press?
Yeah. You want to get in there a little bit. You don't want to be too light, because think of it like a muscle. If you're, rubbing a muscle in your shoulder, if you do it too light.
Because we do this in yoga. We use the tennis ball, to massage our bodies. And pushing down. So it's sort of we're using the spoon to do that with your face.
That's correct.
So would you work on your what areas? You'd work on your forehead, would you suggest? How long?
Yep. So, oh my goodness, as long as you like, Shavita, I've been known to sit there and go through a couple of episodes of my favorite binge watch on Netflix and just work on for an hour or two. So you can spend as long as you like, as long as it feels good. It's going to feel good, and then you'll start to get that sense of relief, and you'll think, oh yeah, that's a good spot, and you just work into there until it feels good, and then you'll swap over. But you can spend 10 minutes on the forehead, and then you can actually work your way. You can, and if I'm going to speed up like a whole facial treatment, we'll start with the forehead. We'll work our way through those.
Okay, speed that up, yes.
We'll speed it up because we haven't done. all day. And then what
Yeah.
we'll do, and we'll start to work our way down, because the brows can get very heavy and tight. And so you actually want to massage and wipe them up and wash them out. Really good for lymphatic drainage and heavy lids as well. And
yes, and especially because our diets have changed, because we're at home and probably eating a bit more salty sort of food, so that affects your puffiness of your face and alcohol.
Maybe a few more drinks than we would like. So
yes,
yeah. So that's really good for that upper eyelid heaviness. You can always just do a very gentle wipe. You don't want to press the eyeball too much. That's not very comfortable. But wherever there's bone and a bit of muscle, go for it. And a little bit of pressing with the back of the spoon here under the eyes. And it's really nice. You can stick this in the fridge, have 2 spoons going at once. And if it's nice and cool, and if you've got some bags under your eyes, you can actually use the cold spoon straight out of the fridge and just let that cool under the eyes, and it feels fabulous.
Oh, I like that tip. I like that tip.
Very good for lymphatic drainage. Helps to clear the bagginess and the darkness. Then we get down to the cheek area. I just like to swipe out. We don't have too many knots here, but more lax skin around the mid part of the face. So that's where the facial yoga really comes into play, which is something else which we can share with the watchers later. But that is about the toning side of things. So
we need to learn that.
Yeah. But it's really nice for lymphatic and blood flow to swipe out.
I notice you're going outwards. It's focusing on outwards. Is that the way to do it?
Yeah, in Chinese medicine, particularly because we're so focused, when we're using our brains all day long, all the energy's stuck up here. We need to sort of wipe it out and get a bit of circulation. So you always sort of want to go outwards as well. It feels really nice.
What about these lines here?
The nasolabial lines, these old tricksters. I've got, I can get a little bit deep when I work too hard. So it's nice to get the edge of the spoon and literally rub those out. And there's another technique in facial yoga you can use to work it from the inside out. But you can just get the edge of the spoon here. You can see I've got it there. Yeah. And you can actually rub these, not too hard. You don't want to be creating bruises, but just hard enough so you can feel it. And you can bring it right out to the jaw. When you get to the masseter muscle, which is actually, for your information, this muscle here is the strongest muscle in the body. You want to,
strongest muscle in the body.
Absolutely.
Oh, wow.
Yeah. So this guy gets really tight. So you really want to work in with the masseter with the spoon. It's fantastic. And just massage that nice big round circles. You can even come right the way down. And then coming down to the chin, it's really nice to swipe out from the chin, particularly if you're talking all day and you've got a lot of, or if you've got lines around the lips or acne. As long as you're using a really nice clean spoon, it just helps with that lymphatic drainage. It's going to help bring some fresh blood to the area. In Chinese face reading as well, if you get puckering in the chin, that can usually mean an issue with, we can say, fear and kidney energy, and we like to work on that too in Chinese medicine. But there's lots of stuff that you can work on, and
what about the neck?
Yes, the neck, big one. So I put out a little video on my website about how to do a full neck treatment, but I'll just do a mini wrap of that for you. So there's all these, if I do a scary face, you can see there's lots of muscles there. Yeah, that's called the platysma. And then here you've got the scalenes and the sternocleidomastoid muscles. So these are really large muscle groups. These guys work really hard all day, particularly if you're at a computer. So what I suggest you do is get this spoon, back of the spoon, and just swipe down all the way to the clavicle, which is your collarbone there, and just get nice big sweeps down the muscles. They will love you for it. You'll relieve a lot of tension. At the front of the neck, just be mindful to go along the angle of the jaw and just press to what is comfortable, but don't go too hard because you've got some delicate organs under there. And you can actually, the very front, you can actually go up, sort of like an upward sweeping motion is better for the skin than going down. Down is more on that sort of neck area. Yeah. So on the neck, you want to go down and back, especially the back of the neck. If you've had a bit of tension, it feels so good. And then when you get to the front, just doing a lovely sweeping up
Oh, I
motion.
like that.
Yeah, and so and that's sort of the whole face. What have I missed? I think that's pretty much it. Yeah, and getting into the temples and the jaw is really key if you have TMJ, if you get headaches, jaw clenching. Is really common.
Yes,
Issues with stress.
especially if we're stressed at this time of the here, we can be clenching our teeth at night, and the stress here as well from the laptop. Okay, if we've got some time, we have. What about some facial yoga exercises we can do?
Yeah, absolutely. That's really great. So facial yoga, we can utilize some of that to help relieve mask tension. So a really good osteo friend of mine, Stephanie Trember, actually gave me some exercises, and so I recommend checking out her blog post, but also the facial yoga. There's a few really good ones you can do. So one of them is kissing the sky, and so you basically make a kissing motion.
I'm going to do this with you.
Yep, and you just hold down the front of the neck and go. Big kiss, really big kiss.
Oh yes, I feel these muscles getting stretched.
And not only is it going to activate the front of the neck, it's going to you want to kiss the sky and make a big pop with your mouth. That's it, and really open up really wide. So you're really stretching and opening through the jaw muscles. Yep. So do that several times. Don't forget the kiss and the pop, because these muscles, we want to open up through here. Another really good one is to you can keep massaging the jaw around here. That's really important, because this is actually where it gets really tight. And you can massage the inside of your mouth with your tongue.
Okay.
So around the cheek area too. So see these lines that I was working with before?
Yes.
You actually have
These are the ones that come up. I've noticed here, and here, and then here.
Yeah. So you can actually rub the inside of your mouth with your tongue, and it's going to help the circulation, and also help release some of the tension around the mouth and around the jaw.
Yeah.
And another thing that you can do, and it's just a really nice, simple neck stretch, is just hold down the clavicle and stretch the neck to the side. It's even more holding in the front. Yeah, that's it. And so you're actually getting a sort of a side front stretch.
Yeah, I can feel that.
And as you breathe, just kind of like do like a lion's breath out. Yep, that's it. And you're going to get a nice extension through the side of the neck, and also a nice opening, a widening of the jaw. And you do that both sides, and that will really help combat some of that mask tension if you do have to wear a mask all day. Yeah.
And another thing we touched on when we had our conversation earlier is how our breathing has changed when we have the mask on, especially if we're wearing it for a long time. Can you just go into that a little bit for us and how that?
Yeah, absolutely. Yep. So the breathing, we're doing much more mouth breathing now because we're having difficulty getting enough air with this covering. Yeah. So a lot more people are breathing like this with their mouth open, and it's actually it's causing problems with the jaw. Also creating a little bit of an imbalance in the oxygen levels in our system. And so it's not necessarily a bad thing, but it's actually quite fatiguing for the system to breathe like that. Imagine just having your nose blocked all day long. So it's really important to, at the end of the day, if you get your mask off, to make sure that you're closing your mouth, even do a little bit of alternate nostril breathing, like this pranayama breathing. Yeah, I don't know. You do that with your classes. So
yes, we do that with our students sometimes with yoga.
Yeah, in one nostril, block it off, out the other one, and it'll actually help to recirculate the air and reactivate that nostril breathing pattern. It's also very calming. Breathing with your mouth open activates the sympathetic nervous system, which puts us more into fight-flight mode. and it creates a bit more stress in the system. So by making sure that you switch back to nostril breathing, which is more of a calming breath, and doing the alternate nostril breathing, it's going to help you to unwind at the end of the day. That mouth breathing causes lots of jaw tension and headaches and problems at the moment as well. So
So is there anything else that we can use at home? Like I like to use coconut oil, oil, the hard one, and then just put it in my hand and just put it around my face and my body. I love that. Is there any other tips you think we can sort of use if our skin's getting dry as well because that mask is there?
Yeah, well, so look, just as a general sense, if you do find you are getting really dry skin and you're putting lots of moisturizer on it and it's just kind of not working, it's always worth to have a check, a bit of a health check with your Chinese medicine practitioner or your naturopath to check in to see what's going on internally. There might be some issues or imbalances that may need to be worked on in order for the skin to nourish itself from the inside out. So it's always good to start with nutrition and what's going into the system, and then other than that, if you're generally pretty okay, but you're just wanting a general moisturizer or something to nourish the skin, I couldn't agree with you more. The coconut oil is one of the best things to use. Cold pressed olive oil. There is a really good recipe for a face mask that we have up on our website that one of our doctors, Dr. Zoe, did, which is egg whites, honey, and oats, and it's it's all fruit. Nice. Oh, it's beautiful. It's really simple. Just put all those ingredients together, pop it on the skin, and it does a beautiful job of detoxifying the skin. A very slight lightener as well, so it helps to deal with any pigmentation or melasma. But that's that's a great one. That
so that was egg white,
honey, tablespoon of honey,
and oats.
And you just want to blend up the oats a bit more. I've tried it without blending the oats, and it just falls off on the floor in big clumps. So you just want to finely chop the oats up. And you just pop it on the skin and let that dry, and it is magic. And you know what? Costs you nothing. It's beautiful.
I like that one. I'm going to try that. So we've got some questions popping up. So if anybody's got questions, please pop them up. Here is one question. Can you ask, about the lines around the eyes? Is there anything extra we can do for these eye lines here?
Yeah, so look, there's lots of different causes for lines under the eyes, but the best things that I can recommend for you are if you are finding that you're getting lots of fine lines, have a look. You might need to do a bit of a nutritional check. What is causing your skin to wrinkle prematurely under the eyes? What is causing that thinning? So first of all, look at is your body producing enough collagen and elastin and enough moisture, because the skin under the eyes is very thin and it's very susceptible to damage. So have a look. How's your diet? You get maybe too much booze, too much sugar. How's your nutrition? Good to check in with your practitioner about that. And then for treatment, I recommend the derma roller, and Shavita's got her derma roller here. So this
is one of the tools that the lovely Sheena shared with me, and I never discovered it until I met you. And I love this. So you basically just roll, and then that way, and then diagonally.
And we've done a whole video on how to do it. Yeah,
I've done a video on that one, and you've done a video on that one as well. But these are great because as long as you disinfect them with alcohol, not the drinking type, the spray type, and then I do it at night. I do my neck as well, and then I put beautiful, nice, good cream or some sort of serum on because it sucks it in much more deeply. And that I might do once a week. If I don't, I've got another question pop up. Oh, here we go. What's this? What's the best way to do the breathing exercises?
So the pranayama breathing exercise. Well, Shavita, you could probably do that because
I can do that one.
You're
so
the
what
yoga
you do is you hold one nostril,
Yeah.
and you exhale out of one nostril, and then you inhale, pause, block, and then exhale out of the other nostril. Inhale, pause, block, exhale, inhale. And you might find one nostril is more clear than the other, but when you start doing this breathing exercise, it clears it up. It also gets the left and right side of your brain working as well. So that's how I do it, the alternative, it's called aloma viloma, alternate nose nostril breathing.
Yep.
There is another, and there's so many different exercises you can do. You can do box breathing as well, where you're breathing in for 4, holding for 4, exhaling for 4, holding for 4, and repeating that. So
That's
it just depends what suits you.
Yeah.
I've got another question here. Breathing exercise. What's this one? The central heating really dries out my face each winter, resulting to red eczema and blotches. Do you have any other tips aside from face masks? That's a good point, because everybody's got their heating on all the time. I have.
Yeah. It's a real tricky one. So, yeah, look, the first thing, my Chinese medicine brain goes straight to what inflammation is going on in your system that you're actually getting eczema. Or if it's just, I wonder what might be going on there internally that's causing that inflammatory response, because sometimes when people's inflammation markers are up, they react more strongly to irritants like a hot room. So I'd be sort of thinking about what's going on there, but to avoid that happening, to avoid your skin getting really dried out, I would just be really mindful of what you're putting on your skin. So keeping it as super natural as you can, something like coconut oil, or like I use a green tea serum in the clinic on my cosmetic acupuncture clients, which is really nice and cooling and simple, and making sure that you've got that barrier between you and the environment is really important. So you may need to be moisturizing a little more as well, maybe putting on an extra layer. This is just general advice. So not taking into account your individual circumstances, but just off the top of my mind, making sure you've got a barrier and thinking about what's going on internally for you to get that reaction. Yeah.
I find my skin is dry because of staying indoors more, because we're not going out as much. I have to put a couple of layers on. So at night, I might put one layer on, let it sink in, then put another layer on, and even 3 layers on. Just once or twice every other night, I might cake it on a bit. And it just really helps hydrate the skin. And also, I'm finding I'm forgetting to drink water because I'm at home. So go back to your bottles and keep the liters of bottles nearby, so you make sure you're drinking the water, because when you're working and you've got your normal desk, you're used to it. I've got another question here. Can you purchase a derma roller on its own? Heard lots of positives about it. Where can you purchase it? You gave me this one with my treatment.
So I sell them in the practice. So you can just get in touch with us and we can ship one out to you. Okay.
And that's good, because you're in Unicorn, so if you're in Melbourne, you can send them out.
Yeah, so I sell mine for $55. I don't charge hundreds and hundreds of dollars like some other places, but you just get in touch with me and I can send one out to you, no problems.
Perfect.
Yeah.
Any more questions? Can you purchase the derma? What's this one? So you've answered that question. Where do you purchase it? And when you're purchasing, another question I wanted to ask you, when you're purchasing a derma roller, say if you're not in Melbourne and you're overseas, what sort of derma roller should we look out for? Because there's so many different varieties.
Yeah, so look, there are different varieties. Look, I just go for the ones that are the stainless steel. 240 needles is perfect. I find the ones with fewer needles, I think there's varieties with about 150 needles. I actually find them more painful. I don't know. It's about how they roll on the skin, and they can be a bit more sore. So, but, you don't need to go. I wouldn't go for the electric ones either. I've trialed them, and they're way more painful than they need to be. So,
and the size of the needle, because I know they come in different sizes.
Yeah. So I generally start with the 0.5 millimeter for most people. So if you don't have deep acne scarring, if you have scars that we need to work on, I probably go a little bit deeper. But if you've just got normal skin, then 0.5 millimeters is usually deep, long enough to get to the deeper layer of the skin. If we go too much deeper, it can actually cause bleeding if you have thinner skin. So I sort of started around the 0.5 benchmark. That for most people is good. And then once you've been rolling for a little while, you can graduate up to a 1 millimeter in length, because your skin over time, as the roller works, it creates little tears, I guess you could say, but that you can't see them. And then the skin decides, oh, okay, I need to repair, and I repair stronger and a little bit thicker. And that's that whole layering process that happens over time. So start with a 5 and then graduate to the 1. And you need to change the roller every, you need to change it about every 2 or so months anyway, because it gets blunt. So you don't want to be spending heaps on it, and you don't want to be, you've got to upgrade it every couple of months anyway. Otherwise it'll get painful to use. Yeah.
Fantastic. So Sheena, another question. Any tips on the best moisturizer for lips?
For lips? Wow, good question. So look, I'm going to be honest and say, from a holistic medicine perspective, if your lips are really dry, I wonder what's going on for you to cause the dry lips. Have you been using some stuff on your lips? Because they're actually, the best moisturizer for your lips is the Lips Own natural oils. So I avoid, if I can, to use stuff on the lips, because if you start putting too much on, it dries out, and the body's ability to regenerate that moisture is really inhibited. So I probably want to avoid anything. But if you must, I would probably say stick with Shavita's hot tip of coconut or cold pressed olive oil, and that's it. That's all you need. And then
I love coconut oil. Just to be real.
Yeah. And
One more question we've got here. What would alleviate deep vertical wrinkles on my forehead between the eyebrows?
Yeah.
I had this, but they weren't that deep, but you did acupuncture on it, and that made a big difference for me.
Yeah. Yeah. So look, I do cosmetic acupuncture, and I never say that I can treat or cure or fix anything, because, everything is relative. But I do acupuncture on what we call the 11sies. Yeah. And they're really common. And it's, when you think about it, it's muscles in repetitive motion, constantly creasing the skin. And if you sit there and you frown at your iPhone all day because you probably need glasses, that's usually what happens.
Yes.
So these form. So acupuncture, I work on those with acupuncture, and that's what I use to do in my cosmetic acupuncture treatments.
And one more question. How often should you derma roll?
Yep, up to twice a week is more than enough, because you're actually causing micro tears in the skin. You've got to give it time to heal.
Perfect. Dr. Sheena, thank you so much for your time. It's been so delightful talking to you. I could talk to you for hours about this sort of stuff, because I love this
talk all night.
Skincare. And what I found, that once you get your skincare, just do 1 or 2 things. You don't have to do a whole thing. Just do what suits you. It doesn't have to take hours. I might use a derma roller once a week. I might layer the cream on once a week. And what you put in your body, I suppose, is probably the most important thing.
Yep, definitely. People forget about that, and they look. It's one of those things that there is lots of nonsense out there, and it's really hard to know sometimes what is the right thing to do, what's the right thing to put inside the body. So it's always good to get expert advice and get your own tailored advice on that. Get your expert on your team to help you with that, and that'll help with skin as well.
Excellent. Well, thanks for watching, guys. Thank you, Dr. Sheena. If you've got any
Thank you.
questions, pop them on and we'll just keep an eye out and answer them when we get a chance. And have a beautiful weekend, everybody. Thank you for watching. Thanks, Dr. Sheena.
Thanks, Shavita. Have a lovely night. Thank you for
You
inviting
too.
me on. It's been a pleasure.
No problem.